Health officials in China are saying this morning a dramatic spike in respiratory illnesses in the country shows no unusual or new pathogens. The World Health Organization had asked the country for more information after Beijing Children's Hospital reported seeing 7,000 patients a day that exceeded its capacity. What it's saying is that the large increase in illness is due to the lifting of severe COVID restrictions that limited people's movements for the past 3 years. Dr. Isaac Bogosh is, of course, an infectious disease specialist, good friend of the show. He's joining us this morning with a closer look at what all of this means. We know you so well, I can tell that you've added a printer to your background. Good morning.
Oh, my God, there it is, right beside the chicken.
Hey, great to see you this morning, and good to have this update because the numbers were surprising when we saw them come out of Beijing. We've got a bit more context this morning. It is not unusual for the WHO to ask countries for more information, but it is unusual for the WHO to make the request public, and I'm assuming that's because there was concern in other countries. So how are we?
Yeah, I mean, I think this really started with a epidemiologic report on November 21st from ProMed Mail, which is a global surveillance system saying, hey, there's a lot of respiratory illnesses in northern China. It's not entirely clear what they are. Said with zero xenophobia, zero racism. We just have to acknowledge that we obviously just came out of a terrible pandemic. We had another respiratory virus emerge from China in 2003 with SARS-1. So when you hear respiratory viruses, China, unknown, obviously a red flag gets raised and you need to have more information. What we were looking for, and of course what the WHO was looking for, is transparency, honesty, accuracy, and speed of reporting. And they had a conversation with Chinese health officials on November 23rd. The Chinese health officials said, yes, we're having a spike in respiratory illnesses, but these are known respiratory illnesses. This is flu. This is COVID, this is RSV, this is a bacterial infection called mycoplasma that's not uncommon. So they said it's a surge as a result of lifting the public health measures. And, quite frankly, we had a very similar surge this time last year among our pediatric population. Many people remember our pediatric hospitals were overwhelmed with RSV and influenza this time last year. So it might be the same thing that they're having now.
Yeah, I do remember chatting with you about that then. Symptoms that people need to be watching out for?
These are very much the same, right? It's not going to be, it'd be very unusual to tease apart one pathogen from another based on symptoms because they have such overlapping symptoms. They're very similar respiratory syndromes: fever, cough, shortness of breath, wheeze, sometimes sputum production, sometimes lethargy. Stating the obvious, if someone's really unwell, if they're not able to care for themselves, if they're having difficulties breathing, of course you have to take them in for medical care. The vast majority of people who are having these symptoms will recover in the comfort of their own home, though.
So part of the reporting back to the WHO is that because COVID restrictions had been lifted, more people are gathering together, hence the increase in illness. We also saw a dramatic, here in Canada, increase in colds, flu, RSV after restrictions were lifted. So that is a plausible explanation for what is happening with this dramatic increase. 7,000 patients a day is a big number.
It's a huge number, and I think we're in the stage where we should trust but verify. So it's a plausible explanation. It's a likely explanation. We hope it's the correct explanation. It's certainly, we had that exact same issue here. And if we look at what's happening right now in Canada, we look at our influenza levels and RSV levels, they're about what would be expected in a pre-pandemic year for this time of year. So, last year was awful. We saw kids, the pediatric population was getting pummeled. The pediatric hospitals were so overwhelmed. I'm not saying it isn't an issue this year, but we're seeing what would be expected. I think the issue, of course, this year is we also obviously have COVID on top of RSV and flu, which adds pressure to an already stretched healthcare system.
Dr. Isaac Bogosh, always good to hear from you. Have a great weekend.
Have a great one, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.